Misty's been a patient in my office actually for quite a few years, and I would estimate 7 to 10 years ago she began to notice that her energy level really just was not where she wanted it to be. And so we began to look at additional options that might include hormone therapy, and so we began with hormone replacement therapy. I particularly like Bio-Identical Hormone Replacement Therapy, which is where the hormones that we utilize in the body are the same as the body's own natural hormones. And we also like to utilize testosterone, although most individuals think of that as a male type hormone. Is extremely important for women. So ultimately, after discussing options, we felt like pellet therapy would be an ideal choice for her. The pellets include both estradiol or estrogen as well as testosterone.
Well, my life pre-treatment was kind of a surprise because I thought, well, I'm just kind of getting older and a little slower, until my husband actually brought it to my attention. He brought an article home one day and he says, honey, I think this might be what's wrong with you. And I'm like, really? So I read it, and it was about perimenopause and menopause, and I was shocked because I thought, well, I'm just kind of tired, it's just kind of part of my life. And I read it and I'm like, menopause, not me. I'm only 45, and that was 7 years ago. I was feeling a little bit achy every day in my joints and things like that. My hair was changing. You know, my focus was really starting to change. I have a very high profile position, and I was having a hard time kind of keeping up, maybe memory. You know, a little bit of the hot flash and the night sweats was happening to me. And I started not wanting to do the little things in life just because of the tiredness. So I thought, you know, I probably do need some help in this area. We moved on forward for another couple of years. We came to the pellets, and that has been my treatment for the last several years, and I'm very, very, very pleased with that. We have the pellets inserted, you know, under the skin. Very simple process. I go back to work. I have very, you know, a few limitations, you know, with lifting and things like that for several days. I feel so much better. I feel very young. I do anything I want to do, and I did not expect it to do as much as it did. I was very surprised how much more it was able to do for my life.
So Misty, thank you for coming today and talking with us. Of course, we started quite a few years ago with some supplements and lifestyle, exercise sorts of things. Then about 3 or so years ago, I believe we moved on to pellet therapy. How have things gone since then, since we initiated the hormone pellet?
It really has been amazing. At first I thought, really, can this really make that big of a difference? And it has really made that big of a difference. I can remember when we first started, you were very good about telling me it's really my my option to do this, and you took it very slow with me and made me understand, and I was like, really? Well, within 5 days I could really tell a difference, and within 2 weeks I was really pepping up my step.
You'd also mentioned joint pain.
Yes.
You don't commonly associate that sometimes with menopause, premenopause, perimenopause, but I've found in my patients not unusual. So you're saying your joint pain and things did get better?
Yes, I do not have that anymore. I used to have to take a Tylenol to get up, and I don't do that anymore. My joint pain has gone, so I feel much better. I feel like myself again. So thank you.